Hello there, I'm Lisa. My name's Lisa.
What is your job role?
So my job, I am the chief nurse for Suffolk and North East Essex. So a lot of Suffolk, not Lowestoft, but a lot of Suffolk and then Colchester and Clacton areas.
Do, do people with learning disabilities get the COVID booster this winter?
So a lot of people with learning disabilities will get the COVID booster. The booster is being given to people who are most at risk of getting ill from COVID. So it's for all people over 50, whether you've got a learning disability or not, and it's for health and care staff. It's for people with a learning disability who are on their GP register. So that tends to be people with a kind of moderate or severe learning disability and people with Down syndrome. So most people with a learning disability will get the COVID booster.
Will they happen at the same time as the flu vaccine?
Yes, we're trying to make it easier for people. So the people that can get the COVID vaccine will also be people that will be eligible for the flu vaccine. So rather than making two trips and having all that kind of anxiety that some people have about having a vaccine, we are making it available that you can have them both at the same time.
If someone didn't want the vaccines at the same time, what are their options?
If people don't want to have them together, then that's fine. They can have them separately and they'll just get that when they get called for their flu jab, they'll just go and have that in the normal way. Most people do it either at the GP or at Boots or wherever. So you don't have to have them together. We're just kind of trying to make life a bit easier for people by giving them the option.
Do support and family carers get their free COVID booster this winter?
So support carers will get them. Family carers, if you are caring for, well, if you're over 50, you'll get it. That's the easy bit. If you're caring for somebody with a learning disability that has been called for a vaccine, then you too will be able to get a vaccine.
Is it safe?
So no medicine is ever 100% safe, but the vaccine is as near to that as it can be. It's very, very safe, and it's certainly safer than having COVID. So nobody will ever say it's 100% safe, but there have been very, very few incidents from Moderna, which is the vaccine we'll be using, and it's certainly a lot safer than getting COVID.
If people have both the COVID vaccine and the flu vaccine at the same time, will it be in one arm or both arms?
That's a great question. So we would prefer to do them in two different arms, just because if you have the two vaccines very close together and you get a bit of swelling, it might make one arm, really painful. If there is a really good reason why we wouldn't do them in two different arms, then we would do it quite a way apart on one arm, but we would prefer to do it in two arms, and we'd need to have a good old discussion and chat about doing two vaccines in one arm.